the real issue is, how do we keep this from happening again? There's some fairly straightforward information that I'm going to share with you, and there's some that's a little bit deep. I'm a little concerned about the deep information because I spend a good part of the time digging myself out. I don't want to bore you, but people always say to me about kidney stones, okay doc, you got rid of the stones, but tell me about what I can do to keep them from happening again. So let me at least try. First off, our kidneys put out a great deal of material that if they didn't, we would be very sick very quickly. All of them are in solution. And in stone formers, patients who do not have some of the mechanisms I'll talk to you about briefly in a moment, allows the calcium, which is the predominant component of stone, to crystallize, and that is where stones come from. Now there's other components of the urine, uric acid, which is a product of the metabolism of many foods, beef, and other things I'll talk about specifically here. Occasionally there'll be people who have problems with infection in the kidneys chronically, and those create stones, but fortunately a small percentage, and not really what I'm talking about generally speaking for an ambulatory environment. And then there are stones that are really difficult to diagnose and to treat, called cystine, but fortunately for us they're a very small percentage of the stones. I'm not going to entertain all of the causes for all of these stones. Now, oxalate is present in almost all the foods we eat and is obviously secreted in very significant concentrations in the urine. The things that are listed there: rhubarb, chocolate, coffee, and as I said a moment ago, meat. So what we tell our folks simply after a single stone is drink more fluids. What does a lot of water mean? Well, it doesn't mean drowning yourself. I've actually had patients who became hyponatremic. They drank so much water. In other words, they diluted their electrolytes. That's not what I had in mind. 8 to 10 glasses of water, and let's call them 8-ounce glasses in the course of 24 hours is plenty. And I think important, at least at first after a stone, and then you can taper it back to some degree. There are a lot of other types of tests we're going to do, and we're going to touch on those in just a moment before deciding exactly how we should advise you. And one of the things that our practice is going to do is we're going to try to locate a dietitian within the city who's knowledgeable about altering diets to deal with various types of stone formers. So, should we change your diet? Well, take a look. These are the foods that oxalate is in, and oxalate is a major part of stone formation. Clearly, it would take a special interest to be able to handle that well, and that's why a dietitian makes sense, and we'll be working toward that goal. We should evaluate patients who have stones even the first time. The simple reason is that more than 50% of those people will have another stone within 5 years. Now, we do a number of things. We look at the diet, the medical history, and we do a lab work. These are ways to understand the total kidney function. This is a mineral that would be combined in stone disease, and this is the parathyroid gland in the neck that has a lot to do with the way your body handles calcium metabolism. When we retrieve the stone, we can send that to a lab and they tell us what this stone is made of, which helps us understand what to do for that particular stone former. We want to make sure there's no infection, so clearly we should study the urine and the KUB film both before and after we had treated the stone. And for most stones, because the majority of them are calcium-containing stones, are visible. Uric acid is not visible on a standard X-ray, but is visible on a CAT scan. Now, we know what the normal findings are in the urine for these types of findings. This is calcium. citrate, which I'll tell you a little bit more about, uric acid, and then of course the pH, the acid-base balance in the urine. If you have more than 200 milligrams per deciliter of calcium, you're hypercalciuric. Now, one of the things that's fairly commonly known is that sodium drives calcium. So if you take a lot of salt, bag of potato chips, popcorn, salt on it, so on and so forth, you're bringing a lot of calcium into the urine. If you have a determination on your urine that your calcium's high, one of the things you want to do is get rid of the sodium. Good thing to do would be stop taking the potato chips and the popcorn, but you can also get rid of it with thiazide diuretics. And I would guess most people in this room know something about diuretics, and thiazide is a particular type. Now, citrate is a material that's in our urine, and it is an agent that keeps stones from forming in many people. And people who don't have enough citrate tend to have stones, and that may be a genetic defect. But if we have low citrate, we call that hypercitrinuria, and we can replace it with a commercially taken product, such as potassium citrate. Uric acid, on the other hand, should be less than this amount, which is 600 milligrams per deciliter. This means we have high uric acid in our urine. We know that comes from the degradation in large part from meat, so we diminish the amount of meat we consume, and there is a drug called allopurinol, known by other people as Xyloprim, which is its commercial name, that can very significantly drive this component down. Now, uric acid stones tend to form in a urine that allows the uric acid to concentrate. So if you have a pH of less than 5.5, which is an acid pH, the uric acid stone tends to grow. That would be a low pH, and you can change the pH in an upward fashion by using potassium citrate, which is another medication that we could give you orally. So for low-risk patients in general, we don't try to change the amount of calcium they take. We would look at their oxalate. We do talk about their meat consumption, and we also talk to them about sodium restriction and high fluids. So that's sort of a basic formula for what you do for people who form the most frequent type of stones. Now, we talked about potassium citrate and why it's good for stone disease, because if you have a stone that grows in an acid environment, if you raise the pH of the urine, it will dissolve. But I wanted to be more holistic. Let's talk about some foods that might do the same thing. Oranges, grapefruit, lemon, raspberry, pineapple, and cranberry. So those are things to consider if you have an analysis and, for instance, you find out you have uric acid stones. Most people would probably wind up taking Xyloprim or allopurinol, as I pointed out earlier. Now, hypercalciuria, I told you that calcium follows sodium. So if we take sodium and we can manipulate sodium, one of the things we'll do is reduce the high level of calcium in the urine. Thiazide diuretics, as I told you, take sodium out of the system, and therefore they lessen the amount of calcium in the urine, and so diuretics can do this. On the other hand, for uric acid stones, you can use potassium citrate, which raises the pH, but you can also change the amount of intake the person has in their dietary average daily intake, and you once again increase fluids. Now, I told you this was a little deep, but these are the things we have to think about if we don't want to have any more stones. Medical expulsive therapy. What does that mean? Well, if you have a small stone in the ureter and you have a medication that will relax the ureter, and we do, amulosum, that medication and taking lots of fluid and maybe even a diuretic, a thiazide, will create a flushing effect, and if you relax the ureter, you may not have to do anything except have a good fluid intake, a diuretic, and you'll wash a small stone out. It takes a few days to do it. You might be discomforted, but you don't have to have a lot of intervention. All stone formers should be looked at thoughtfully. We can manage most with fluids and diet alterations, and for high-risk patients, there's more testing that I did not get into, and we have medications that can help us reduce the incidence of this.